5 health checkups you should avoid after 70 that may harm you more than help. There's a hidden truth that most seniors will never hear from their doctors, a reality buried under layers of routine protocols and hospital marketing. Every year, millions of seniors line up for health checkups thinking they're staying safe, believing that more testing always equals more protection. But what if I told you that some of those very tests, the ones your doctor insists you need, could actually be the primary catalyst pushing you closer to unnecessary surgery, a preventable stroke, or even a future cancer diagnosis? New studies and emerging medical data reveal a staggering reality. Up to 37% of medical tests performed on seniors lead to a cascade of unnecessary treatments, dangerous complications, or lifelong side effects that diminish quality of life. Shockingly, 99% of people over 70 have no idea they are being over-tested. We are living in an era of overdiagnosis where we find problems that would have never caused symptoms, yet we treat them with aggressive interventions that cause real, immediate damage. Gráfica animata, 37% unnecessary complications. One of these checkups, the number one on our list today, is actually responsible for up to 5% of all new cancer cases in the United States. To put that in perspective, that is equal to the number of cancer cases caused by drinking alcohol every single day. You won't hear this in your local clinic, and you definitely won't see it on a healthcare billboard. But the truth is buried in the peer-reviewed science. And today, we're uncovering it all for you. In this deep dive, we explore the 5 health checkups you should avoid after 70 and the terrifying truth about what they can do to your body when applied without specific symptoms. Everything we discuss is backed by real clinical data. You won't believe what made it to the number 2 spot on our list. But before we begin, let us know in the comments below, where are you watching from? What is your age? And have you ever regretted a test or a procedure? Do you think seniors are tested too much? Testo a schermo, where are you watching from? Your age? We are reading and replying to every single comment with personalized tips and advice, as our goal is to build a community of empowered seniors. Also, don't forget to like this video and subscribe to our channel for more evidence-based health deep dives like this one. Now, without any further ado, let's talk about the first test on our list. It looks completely harmless on the surface, but it could quietly and effectively ruin your quality of life for years to come. Number 5. The bone density scan, officially known as the DEXA scan. It sounds like a smart move. It's a quick scan, there is no pain, no needles involved, and you walk out of the office thinking you now know exactly how at risk you are for fractures. But here is what no one tells you during the appointment. Past the age of 70, a bone density scan can often create significantly more fear and medical anxiety than actual health benefit. Donna anziana che entra in una sala per la densitometria ossea. This scan measures how strong your bones are, primarily looking for signs of osteoporosis. But in older adults, especially women, the results almost always come back showing lower density. Why? Because bone loss is a natural, biological part of aging. Just like developing wrinkles on your skin or seeing your hair turn gray, your bones changing density is expected. It's a physiological timeline, not necessarily a disease state that requires aggressive drugs. Yet, many seniors are immediately pushed into taking heavy medications like bisphosphonates. These drugs are marketed to strengthen bones, but they come with a laundry list of serious side effects, including jaw necrosis, a rare but terrifying condition where the jawbone starts to die, and severe esophageal irritation. The tragedy is that for many, these risks are taken to treat a number on a screen, not a real physical threat. Studies published in the Journal of the American Geriatric Society followed over 1 to 200 women over the age of 70. They found that taking these medications for mild bone loss reduced the actual fracture risk by only 0.3% over 5 years. That is a statistically tiny benefit. Meanwhile, those same women were far more likely to suffer from digestive issues, chronic inflammation, and, ironically, a type of brittle bone structure that can lead to unusual fractures. Grafico che mostra lo 0.3% di beneficio versus I rischi collaterali. Let me tell you about Clara, a 76-year-old retired piano teacher. She was active, had never fallen, and walked 2 miles every day, During her annual checkup, she was referred for a DEXA scan. It came back showing osteopenia, a mild reduction in density that isn't even full-blown osteoporosis. Her doctor immediately put her on alendronate. Within 3 months, Clara developed such severe acid reflux and jaw pain that she couldn't focus on her music. Clara che smette di suonare il piano toccandosi la mascella. By the time we saw her, she hadn't touched her piano in weeks. We worked with her to stop the medication and started a regimen of high-dose vitamin D, resistance band training to stress the bones naturally, and a diet rich in calcium from real foods like sardines and leafy greens. A year later, Clara was back to performing her recitals. She had stronger legs, better balance, and 0 fractures, all without the drugs that were ruining her stomach and jaw. A bone scan may seem like a smart move, but for people over 70 who aren't falling or showing signs of frailty, the better option is lifestyle intervention. Strength training and balance exercises have been shown to reduce fracture rates by over 20%. According to a 2022 study in Osteoporosis International, don't let a number on a screen scare you into a treatment plan that might not even be necessary for your specific body. But as we move up our list, there is one scan that can lead to something even more invasive and terrifying: unnecessary brain surgery. Let's talk about number 4, the brain MRI for mild memory loss. When seniors feel a bit more forgetful or confused, perhaps they forget a name or misplace their glasses, the natural impulse is fear. We fear dementia, we fear Alzheimer's, and we want answers immediately. Primo piano di Arthur, signor confuso che cerca le chiavi. Doctors often respond to this fear by ordering a brain MRI. However, the uncomfortable truth is that MRIs, which show the detailed structure of the brain, rarely give the helpful answers patients hope for in cases of mild forgetfulness. In fact, most MRIs in people over 70 simply show age-related changes, such as slight shrinkage or tiny white matter spots. These are often the neurological equivalent of gray hair for the brain. The real danger is the incidentaloma, finding something by accident. Once those spots are seen on a high-definition screen, they can trigger a cascade of fear, further expensive tests, and even exploratory surgery. In 2021, a study in Neurology Today reviewed over 3,000 MRI scans in patients aged 70 to 85. They found that while 86% showed some form of abnormality, only 3% of those findings were actually linked to a treatable medical condition. That means 97% of those people went through the immense emotional toll of being told, something is wrong with your brain, when in reality, there was nothing that needed clinical intervention. Even worse, nearly 12% were sent for invasive procedures, like spinal taps or biopsies based on these vague results. Consider the story of Arthur, a 74-year-old retired engineer who was worried because he misplaced his keys more often than he used to. His doctor sent him for an MRI, and the report mentioned chronic small vessel ischemic changes. Arthur panicked, convinced he had early-onset vascular dementia. He stopped driving, stopped attending his weekly bridge club, and became severely depressed. But when we reassessed him using a standard paper-based cognitive test, his scores were well within the normal range for a man of his age and education level. Arthur seduto da solo che guarda fuori dalla finestra. We explained that his MRI findings were entirely age-appropriate and typical for someone who had lived a long, full life. We helped him focus on better sleep hygiene, hydration, and social engagement. Within 3 months, his memory issues stabilized because his anxiety had subsided. Unless there are severe symptoms like seizures or a sudden personality change, a brain MRI is rarely the right first step. A much better first step is a cognitive screening test, a simple paper exam that evaluates memory and attention. It's effective, it's cheap, and most importantly, it avoids the risk of unnecessary medical panic. Now, brace yourself, because the next test on this list is one you've probably had multiple times during your annual physical. And it is number 3 for a very specific, dangerous reason. Number 3, the cardiac stress test. It is one of the most common procedures given to seniors who complain of mild fatigue, slight chest tightness, or just not feeling like they used to. The test involves monitoring your heart while you walk on a treadmill or after being given medication that simulates exercise. The goal is to spot blocked arteries, But after age 70, this test often does significantly more harm than good. Henry, anziano sotto sforzo su un tapirulan medico. The problem lies in accuracy. Studies show that in adults over 70, the false positive rate for stress test can be as high as 40%. This means the test says there is a dangerous blockage when your heart is actually functioning just fine for your age. This false alarm leads directly to follow-up tests like angiograms and eventually the placement of unnecessary stents or even bypass surgery. In 2017, a major study published in JAMA Cardiology found that more than half of all stents placed after stress test referrals were done in patients who had no real symptoms or clinical benefit from the procedure. These patients didn't live longer, and their quality of life didn't improve. What they did experience, however, were higher rates of internal bleeding, kidney injury from the contrast dyes used in the scans, and prolonged hospital stays. This is exactly what happened to Henry, a 75-year-old retired postman. Henry was active and walked every day, but he mentioned to his doctor that he felt a bit more tired when walking up steep hills. His doctor scheduled a stress test just to be safe. The results were slightly unclear, so Henry was sent for a cardiac catheterization, a procedure where a tube is inserted into the arteries to check for blockages. A mild narrowing was found, and which is common in a 75-year-old heart, and a stent was placed. That night, Henry had a severe allergic reaction to the contrast dye and developed acute kidney problems. He spent 6 days in the hospital and needed weeks of follow-up care. The worst part? His fatigue never changed because it wasn't a heart problem. He simply needed better hydration and to adjust his meal timing. Henry in ospedale stanco e con la flebo. If you are over 70 and not experiencing classic symptoms like sharp chest pain during activity or a sudden massive drop in energy, a stress test may be an unnecessary risk. A better, safer option is often a simple resting EKG or a coronary calcium scan, which uses much lower radiation and provides a clearer picture of actual plaque buildup without the need for invasive follow-ups. Now we move to number 2, the colonoscopy. This might surprise you as we are constantly told that colon cancer screening is vital. While that is true for middle-aged adults, a colonoscopy is not always a wise choice after age 70, and it is almost never recommended after 75. The risks of the procedure itself begin to skyrocket as we age, often surpassing any potential benefit of finding a slow-growing polyp. The preparation for a colonoscopy is notoriously harsh, involving strong laxatives that can cause severe dehydration, dangerous electrolyte imbalances, and even kidney issues in seniors. Furthermore, the sedation used during the procedure poses a significant risk to brain function in older adults, sometimes leading to prolonged confusion or delirium after the appointment is over. Una bottiglia di lassativo e un bicchiere vuoto. A 2019 study in JAMA Internal Medicine followed over 1.3 million Medicare patients. They found that for every 1,000 colonoscopies performed in patients over 75, only 2 lives were saved. However, over 20 of those people experienced serious, life-altering complications like intestinal tearing or heart rhythm disturbances during the procedure. That is a 10-to-1 risk-to-benefit ratio. Even if polyps are found, many are so slow-growing that they would never cause a problem within the person's natural remaining lifespan. Removing them in an older adult can do more harm than simply leaving them alone. Take Eleanor, a 73-year-old grandmother who ran a small bakery. She had no symptoms, no bleeding, and no family history of colon cancer. But her doctor urged her to get a routine screening. Eleanor, che lavora felice nel suo panificio. Eleanor agreed. During the procedure, a small, harmless polyp was removed. But that night, she experienced such intense abdominal pain that she fainted. At the hospital, they discovered a bowel perforation, a tear in her colon caused by the scope. She spent 9 days in recovery, lost 10 pounds of muscle, and her health has struggled to return to its previous baseline ever since. When we reviewed her history, she had already had 2 perfectly clean colonoscopies in the past. There was no clinical reason to repeat the test at her age. The U.S. Preventive Services Task Force now recommends stopping routine screening at 75 for most people. If you are in excellent health, a stool-based FIT test is a much safer, non-invasive alternative you can do in the privacy of your own home. Always ask your doctor about these alternatives because once you enter the colonoscopy pipeline, it becomes very difficult to opt out of the subsequent procedures. And now we have reached the most overused, most dangerous, and most harmful checkup for seniors in the modern medical system. You have almost certainly been offered this or something similar in the last few years. Number 1, annual full-body CT scans. Often marketed as executive health packages or preventive body scans in private clinics, these are sold as a way to catch everything early. But here is the shocking truth. These scans expose your body to a massive concentrated dose of ionizing radiation that is completely unnecessary for an asymptomatic person. Una macchina tac rotante. For older adults, the risk of triggering unnecessary follow-up tests, biopsies, and surgeries from a full-body scan is incredibly high. There is absolutely zero clinical evidence that full-body scans save lives in people without symptoms. Each scan delivers between 10 to 20 millisieverts of radiation, which is roughly equivalent to getting 500 chest X-rays all at once. According to a 2023 modeling study, the rapid rise in CT scans across the United States may now be responsible for up to 5% of all new cancer cases. That is a terrifying statistic. The scan might find a tiny, harmless nodule or a cyst that has been there for 40 years. But the moment it appears on the screen, the medical machinery kicks in. You are no longer a healthy senior. You are a patient with a suspicious mass. This happened to Walter, an active 80-year-old who used to teach martial arts. Walter felt great but decided to do a comprehensive checkup. His full-body scan found a 3-millimeter nodule on his lung. This set off a chain reaction: oncology referrals, more scans, and finally a needle biopsy. The nodule was benign, but during the biopsy, Walter's lung collapsed. Mano medica con algo che si avvicina sta un tessuto. He spent 2 months in recovery and lost the lung capacity that allowed him to teach his classes. All of this for a nodule that would have likely never changed or caused a single symptom for the rest of his life. Experts now advise that full-body CT scans should never be used for general screening in people without symptoms. If you feel well, your body is likely doing its job. Walter seduto affaticato che guarda altri allenarsi. Modern medicine is a powerful tool, but it is not a perfect one. Sometimes the most courageous thing you can do for your health is to say no to a test you don't need. Real prevention doesn't come from a machine. It comes from staying active, eating real food, sleeping deeply, and managing your stress. Focus on how you feel, not just on the numbers in a medical report. Always ask your doctor, what happens if this test finds something? Will it change my treatment? What are the risks of the follow-up? If the answers aren't clear, it might be time to pause. We want to hear from you. Have you or a loved one ever faced a complication from a test that turned out to be unnecessary? Share your story in the comments below. Your experience could save someone else's quality of life. Thank you for watching. If you found this information valuable, please give us a thumbs up and subscribe. It helps us continue to bring you the truth about senior health and longevity. Choose your checkups wisely, and we will see you in the next video. Stay healthy, stay informed, and take care of your beautiful body.